All right. Well, good morning, everybody. Thank you so much for joining us this morning. We are grateful that you're going to spend the next hour with us as we introduce the community to our new incoming President and CEO, Derek Chubbs. Derek, thank you for being here with us this morning. We really appreciate it.
My pleasure. Couldn't be more excited about being here.
Wonderful. And of course, we cannot let our fearless leader go out with a bang. So Dave Krepko, our current president and CEO, at least for the next couple of weeks, very grateful to have you with us this morning as well.
Thank you. Welcome.
So the format for today's presentation is going to be a 30-minute presentation, if you will, where these two gentlemen are going to just have a conversation and give you a chance to learn a little bit more about Derek's history and why he's here and why he's into food banking and caring for our community. And then we're going to turn it over to you and give you the opportunity to ask Derek and Dave questions that are burning, that you're wondering, that you just want to know. And so many of you have submitted questions ahead of time. We have those saved for the second half of our conversation today. But I also want to encourage you, you have the opportunity throughout our presentation today to ask questions live. So if you're on a computer, it's at the bottom of your screen or wherever the toolbar is for Zoom, you can actually click on the box that says Q&A, standing for question and answer, and type your questions in there. And we will be able to then see them and address them live right here today. Because there are so many folks on our town hall today, we also have some team members behind the scenes that might answer some of your questions so that we can make sure we get to everybody's question today. So please, I encourage you to add questions to our Q&A box today so that we are able to address your questions live here during this town hall. With that being said, I'd like to turn it over to Dave and Derek to kick us off today.
All right. Well, good morning, and thanks for taking time to be on this. And especially, love these Zoom meetings. Hopefully, we hear the traffic was especially bad this morning, so this saves you some travel time too. But very special morning here. And Derek, want to introduce you to this fine group of people in the audience, and congratulations, really. The board did a national search, hundreds and hundreds of candidates applied. It took a good 10 months of very thorough search, and here you are. So you got to be one special human being. So welcome. Welcome.
I could not be more excited about being here. Dave, the legacy that you created and that you'll leave is very, very special. And
thank you.
I knew that before even applying for the opportunity. And I'm honored to be able to continue that legacy on your behalf and on behalf of those that we serve here. I can say we now.
That's right. So, yeah, I'm really excited about the transition and the way it's just, been so well orchestrated and planned, and it works. So let me ask you the first question, who's Derek? Where are you coming from? What kind of life experience, tell us a little bit about your journey, that what got you here today?
Yeah. Well, I'll go all the way back to birth. I was born to a teenage mom who, gave me up for adoption. Smart move on her part. Fortunately, I was, adopted by, an older couple who always wanted a child, and I was the one. And so I don't think there was a national search on that one, but
might have been.
Now, neither of my parents even graduated from high school, much less go to college. My mom was a maid. My dad was a cook. And we led a very modest, quiet, I didn't know we were poor lifestyle. And so I left there, went to school in Atlanta at Georgia State University. And from Georgia State, I went to work for IBM straight out of school. That's really fundamentally, with some education along the way, where I learned the basics around leadership. IBM was very, very committed to grooming, developing, and continued development. As a matter of fact, every year, as a manager, I was required to have 8 hours of 40 hours of training
Mm.
every year. That went in my performance plan. It was in the performance plan of every manager. You know, so that's where I get my passion for employee development, because that's basically the way I was raised. Spent a number of years at IBM, went to work for a company called Pervasive Software. Smaller software embedded, we did embedded databases. So, and that was where I first had the opportunity to gain global experience. I had a team in Europe and a team in Asia. And a funny story I like to tell, I'd never even had a passport until then. And I remember thinking that I might get arrested in Dublin because I got stopped at customs and I hadn't signed my passports. First time I'd ever used it. And I hadn't signed it. So I was afraid they weren't going to let me into the country. And I could still hear that gentleman's accent when he said, "You haven't signed your passport, laddie." But, they gave me some grace and let me in. And
And the search committee missed that on our background check.
yeah, almost arrested in Europe. Yeah. From there, I went to work at Dell, and all along there was a parallel track underway. I've been committed and was raised to serve, my entire life. My grandfather was the minister of our church, and everything was about serving. I've had some really strong mentors along the way who were really compassionate about, or really, really passionate about, if you climb a ladder, you don't pull the ladder up behind you, you reach back and try and bring others along. So I had been volunteering. My first board that I ever sat on, nonprofit board, was a board focused on education in Atlanta for young African-American boys and girls to keep them in school. So I woke up one day and I was struggling with the passion that I had initially had from a technology perspective. Now, don't get me wrong. Those years are very good to me. I have no complaints. And one of those mentors that I mentioned, he and I had coffee one morning, and I said, "I'm losing the passion for this whole, technological revolution." And he said, "So what are you enjoying?" I said, "Actually, what I'm really enjoying is the volunteer work that I'm doing and a couple of boards that I'm sitting on."
Yeah.
And he said, "Well, why don't you go and work for a nonprofit? You've got good skills." And I said, "I can't afford to go work for a nonprofit." At that point, I had kids that are going to be headed to college soon. And but as luck would have it, I was blessed with the opportunity to, a few years later, to become the CEO for the Central Texas Red Cross.
Yeah.
And the call I got actually was from a former colleague who sat on that board, who I worked with at Pervasive Software.
Yeah.
And I wouldn't change a thing, Dave. I'd want to do it exactly the same way, because now I am one of the lucky ones that gets an opportunity to chase his passion
Yeah.
day in and day
Yeah.
out, and get an opportunity to see the results from that. And I did some I became a headquarters guy for the American Red Cross, and I was a division vice president. I managed operations for 9 states, 16 regions, from Texas up to Wyoming, as a matter of fact, out to Nevada and up to Wyoming. And I got that same feeling that I got when I was at Dell. Something's missing here. I'm enjoying the work that I'm doing, but something's missing. And then I realized that I had basically turned into a bureaucrat. I was the headquarters guy, spreadsheets, PowerPoint, meetings.
Yep.
I no longer had the connection to the community. And it's really kind of hard to have connections across a third of the country.
It's impossible.
And so I started a quiet search on my own, reaching out to colleagues. And I had the opportunity presented itself at the Central Texas Food Bank. And here we are. Now you know the story.
Yeah. That's so interesting. I'm getting little flashes of deja vu in my career too, that came out of the ad agency business, enjoyed it, but there was something missing and
Yeah.
a friend, introduces you to this thing called food banking and, your life changes dramatically,
Oh, yeah.
um, and, we're very fortunate to what I call finding that fit in life.
Yeah.
For that to come along and that fit being that intersection between our particular unique abilities and talents, and everybody's got them, right? But when you find that intersection with them and one of society's great needs, it's amazing energy and results can come out of that, and you just kind of naturally draw to like-minded souls when you get into
Yeah.
that,
Yeah, you
into
do.
that space. So that's really cool. Tell me, you have such an extensive career, multidimensional, from international to local and everything in between. Leadership comes into huge play there, right? What would be one of your greatest qualities around leadership? What do you think is gotta be one of the central qualities of good leadership?
I would say, there are several.
Yeah.
And they're the fundamental ones that we all know about if we go down the leadership competencies. But one that comes to mind that I honestly believe has given me the opportunity to do some of the things and experience some of the things, not only from a career perspective, but personally, is adaptability.
Yeah.
And in the corporate environment, there was always focus on how the market was shifting or changing, which meant that the organization needed to shift in order to take advantage of that. And from a leadership perspective, I found that the same thing needs to happen. And starting with your team, it's totally unrealistic to believe that everyone is exactly the same. So you can't lead them the same. Maximum productivity is shaped differently within all of us, and understanding how to get that and taking the time to get that when you have the time. Every now and then you don't have the time, you just have to
Exactly.
move. But in most cases like this one, nothing's on fire, we'll have the opportunity to make that shift. And that requires also a bit of self-awareness, who you are and knowing what works for me and finding that common ground, whether I'm having a conversation or I'm working with you, Dave, or whether I'm working with the board of directors, or whether I'm working with donors like yourselves, or whether I'm working with elected officials, like, in case any of you are on. It requires a little something different. And I will add one other component to that, and from an adaptability perspective, and that is the way I look. And being an African-American leader, I mean, realistically, over my tenure of leadership, well over 95% of those that I managed didn't look like me. And there's another level or exercise on adaptability that's
For
required, because as we have DEI conversations,
Yeah.
all those fears, those guesses, we have to channel those down
Yeah.
and reach a common area. So I would say self-awareness and adaptability, independent of just getting work done. I mean, I call these are those that you don't necessarily think about. When we talk about, financial acumen, business acumen, all those, those are required for the job.
Yes.
You don't
Right.
get here without having those.
Yeah.
But those others, and recognizing the changes in our environments and our people, I think are just as
Yeah.
important.
I love it. Self-awareness, I've been told is like key quality to leadership, and you talk about adaptability, and for our donors out there and the faithful donors over the years, especially that have funded us, adaptability, I believe leads to curiosity. Curiosity's got to be in there
Oh, yeah.
in order to
Absolutely.
be adaptable.
Absolutely.
but that leads to innovation. And, Second Harvest is known for innovation, and thanks to you folks, on the Zoom this morning, your support has really enabled us, provided the resources to do that. And several of you, we've had the opportunity to really co-create programs together. That's kind of the holy grail in nonprofit land to do that. So yeah, thanks for sharing on that. Yeah, many qualities. One other question is, what I wanted you to unpack a little bit. You mentioned DEI, diversity, equity, and inclusion. And here in our strategic plan, that's a major focus. And we've started that work. We're in the early stages. We are learning so much. We don't know what we don't know, right? But I'm really excited that we've started that work and are going to continue it. But from your perspective, filling the chair that I've sat in for 17 years, what's your thoughts on that? What's your approach to that?
Well, diversity, equity, and inclusion, if we are to be successful at it, is not a check the box exercise.
Right.
It's not you can imagine how many classes I've gone to over 30 years on whether it's diversity, whether it's called one thing or another.
Right.
But it's not a check the box exercise. Success requires ongoing relationships and commitments. I was excited when I read your strategic plan when I was preparing for the interviews, and to see that it's recognized and called out and committed to, and the board has to vote on it in order for it to be real.
Right.
And I was really excited about that. In Austin, or Central Texas, we're in our third year of the journey, and we've done large scale meetings. We've done smaller meetings. We do book clubs. I host a series of little quiet, intimate meetings that I call Chub Chats. And those are all part of continuing the dialogue. And one of the first things that I remember sitting down, if I could just tell this quick story,
Yeah.
I remember sitting down with a group of very well-meaning staff members that were the equity team that was and I said, so what can you really tell me about my journey? Because actually none of you really look like me. So, which means that your journey is nothing like mine.
Yes.
You may be able to have some semblance of a conversation with my children, but that would even be different because they're both African-American males. So, tell me a little bit about that. My point here being is, in order to be successful at it, in my opinion, it requires ongoing dialogue, and that dialogue must include individuals who think totally opposite from you.
Yeah.
And I think that's where we tend to falter sometimes organizationally. We get stuck in our own bubble and we don't get outside of that bubble. And one of my favorite stories, President Johnson, who is a Texan, a lot of it's about Texas. A lot of people don't realize, if you look at his history, he's largely credited with moving the civil rights movement forward after JFK. If you look back a little further in LBJ's history, you'll find that LBJ was one of the major proponents around segregation throughout his years in Congress. But what's really special about that is, what better person to move it forward than someone who's totally focused a lifetime on doing just the opposite. Yeah. And that's how we bring these together. So this is a philosophical discussion that we're having as well. But that's how I view it. And I'm comfortable having conversations. I'm happy, I'm comfortable having the difficult conversations, that has not always been the case. That wasn't the case in my corporate days. It wasn't.
I think obviously it's going to really help Second Harvest in their work in that area. And as you talk, I really believe there's going to be opportunity for you to provide leadership within the not-for-profit world, here on that topic, because of your experience. Fantastic. Thank you. So we're going to shift. I want to give as much time to the audience, for Q&A. This is a really favorite part of it. So Dan, I want to turn that over to you.
Absolutely. Well, I
Okay.
appreciate this conversation, gentlemen. As you see, I've got the computer set up here and my phone set up here so that we can see your questions live and we can address them live. And so I appreciate JB and Judith for putting questions in the box. We're going to get to those here in just a moment. But first, we're going to start with some of the questions that came in ahead of time. So Dave, I'm going to start with a softball for you. What percentage of each dollar donated goes directly to providing meals to those who are facing hunger?
Right. We are audited. Well, let me give you the number and where that number comes from. So 97 cents of every dollar is going directly to feeding people. That's a very high efficiency ratio. And where we get that number, we don't make it up, is that we're audited every year. And based on the numbers that are given to us, by the auditors, they are able to calculate that. So, one of our key values here at the food bank is stewardship of resources. And we take that seriously. So Derek's going to take that to maybe 100%. I don't know. No pressure there. We got work to do, Derek. But that's pretty phenomenal on how we can leverage the community's resources. Another number out of that audit shows that for every dollar donated to Second Harvest Food Bank, we distribute $9 worth of groceries. And, we're able to do that because of phenomenal in-kind resources that are provided to us. Volunteerism, at the heart of the food bank. On an annual basis, we have 30,000 to 40,000 volunteers coming into the food bank, amounting to over 160,000 hours of volunteer time. So we can really stretch the dollar. We're really proud of that. We're a 4-star every year. We're a 4-star Charity Navigator, organization. For those of you who might not know who Charity Navigator, but they're the national watchdog on charities across the country, and they rate them from 0 to 4 stars. And we continually get that 4-star rating. And key things that are behind that are efficiency, right? And also transparency. Many of you have already gone to our website, but if you haven't, you go to our website, our 990s there, our financials are there, everything is out there. So I'm glad you asked that question, because that is such a strong motivation. When you donate, you want to know, is this really going to make a difference? And how much of this is really going to go to help people? So thanks for that question, whoever asked that.
Thank you, Dave. Derek, we're going to turn it over to you. We have a question that's actually been asked twice, both by Judith here live today, as well as one of our attendees ahead of time today. They want to understand, what are your top 3 focus areas when you started Second Harvest?
First and foremost, the team. I want to spend time with each one of them, because at the end of the day, if the team isn't functioning at optimal level, we cannot deliver the services to our community or to this community. So I will spend a significant amount of time getting to know my direct reports and everybody in the building, not only just my direct reports, but the drivers, everyone, because I want them to know me and I want to get to know them as well. I'd say the second thing is, I've never lived in Orlando before. So I have a lot to learn around the environment, the geography, the need, the communities. something that the pandemic brought out to us in Central Texas. We found so many areas that were underserved that, Dave, we had just flat out missed.
Yep.
And so, and for all different reasons, from people being homebound to just areas that had just really never come forward and were not visible to us. So I'm a proponent of community engagement. So, and I will likely need your help, or I'll take any advice that you can provide in terms of how I get to know the community, because ultimately, not only do I want to make sure that we're distributing, but I want to make sure that we're distributing equitably across the community as well. And last, but not necessarily least, we don't function unless we have food. So food is, procuring food and the right kinds of food and nutritious food always is at the top. It's a given for food bankers for the most part, but since you asked the question, that's a priority. Now, it was no different in Austin or in Central Texas. It will be any different here, and I would argue it's no different across the 200 food banks across the country. So those would be the three.
Yeah, thank you. I mentioned to Derek earlier that I came to Central Florida 17 years ago from Chicago in a very similar kind of experience. And I told him that Central Florida is really a welcoming community. And for those of you, that we know each other well, that is just so true. And in my first 30 days, I think I met, a lot of the major donors, food donors, financial donors, community leaders. And that was just so valuable.
Yeah.
So for all of you out there, I know you're going to continue to be welcoming, to meet Derek up front and close. But, that's the way it works. And our board of directors, are from the community. So, they open doors, and our staff are in the community. They open doors. So it works. It works very, very well.
Awesome, gentlemen. So before we go to our next question, I just want to remind everybody, if you do want to ask a question today, all you have to do is click on that Q&A box on Zoom and go ahead and type in your question. We see them live. Sky, I see your question that just came in. We're going to get to that here in just a minute. We have a few more we're going to get to as well, but keep those questions coming. We have a full 30 minutes left, and we want to make sure we get to answer all of your questions live today. All right, so gentlemen, I have a question, kind of a two-part question that I think there's a spot for each of you to respond here. So Dave, we're going to start with your spot here. We have a couple of our health partners, local hospital systems, health foundations that are on live today with us. And one of them asked, how might Second Harvest help to improve community health through nutrition in partnership with other health organizations?
Yeah, I love that question. And I know who asked it, Patty. So thank you. And Patty's not a plant, okay? But it was probably 6-7 years ago that Second Harvest, we asked the question, what is the role of the food bank in community health? And at first, some people looked at us a little odd, but as we continued to answer that question, it was amazing what came out of that. There's so much to talk about that, so I'll keep the answers as short and concise as possible. But what came out of that is that we realized that we needed that connection with other partners. We're not going to seriously answer that question or deliver on it on our own. So we formed a health and hunger task force, and that continues today, 6 years later. And we're actually convening it. And we have the major hospital systems at the table, the federally qualified health clinics are there, the county health departments, we have higher education there, some researchers, and health insurance companies. And it took about 1.5 years of just meeting and talking to each other to understand each of our spaces. And, the nexus was there that because of the number of low-income people that were suffering from dietary related diseases because of poor nutrition or lack of access to food, those factors, and the devastating kind of health effects of that, and what that means to emergency rooms and hospitals, and the incredible cost to all of us, you know? So the healthcare industry wants to reach those folks. We know where they are. We said, we're in an agricultural state. We have over 300 commodities grown here every year. We have access to that. And if we can provide nutritional education. So we brought on Advent Health to our board of directors. We brought on Orlando Health onto our board of directors, that if we're going to really be serious about this, we hired some nutritionists to be on the team. And it has, here's where we are today on it, that we are, again, co-creating programs with the healthcare partners. You know, we're not dreaming this up on our own. And I want to just give you a couple quick tangible examples of that. And this is a new one. I want to refer to a couple little notes, but we've done we have many pilots in the works over the years, and they're really starting to bear fruit. But here's one particular one. And this is with the high-risk maternity clinic at Orlando Health, okay? We are in tandem and coordination with them. They have identified in this small pilot 60 pregnant ladies, low income, low access to food. And we are now delivering diabetes-friendly food to their homes, right? Along with dietary counseling. You gotta, the food's important, but to have that counseling as well is critical. So we're working hand in glove. It's a really new pilot, like I said, with 30 moms, but here's the outcome, okay? And this is the most exciting thing. I've been told that there's been 6 full-term normal babies born. It doesn't get better than that. So it's that kind of, very specific outcome that you could start to build on. And if we can continue this work, I really believe, and we're starting to have conversations with the right folks about how can Medicare and Medicaid pay for this in the future, because it's such a specific health outcome. So, when you're able to have that, it affects obviously those moms, those folks and those families, but it affects all of us when you really think about it. Here's one more example I want to give you. This is really exciting. And I wish this is one of the reasons I wish I wouldn't have retired so early to see what happened here. But I'm going to be talking to Derek on the golf course about this stuff and how it's going. So we're looking at producing medically tailored meals, specifically, focused on diseases, specific diseases. And this is for the low income population that have, low or no access to good food. We're part of an accelerator, a national accelerator, one of, I think, 3 nonprofits in the country that are in this. It's going to launch in the summer of 2022, but we're doing a lot of planning right now. But it's called the Food is Medicine Accelerator. There's 2 other organizations in Boston and New York that have been part of this. And so we're speaking to them of how do you do it? What are the mistakes maybe made? How can this function? And this is all being done with the Harvard Center for Health and Policy Foundation. So you're talking about Ivy League, Harvard, working with them on this. We are so excited about this, but this is going to take us yet to a whole nother level. So Patty, I hope that answers a little bit how we're not going to do this alone. We've got to continue to do that. And we're going to continue to discover. So thanks for asking that question.
All right, Derek. We gave Dave the harder questions. It's your turn now. We're going to put you on the spot a little bit more. So Dave mentioned we have a number of healthcare partners, and JB from Advent Health is actually on today live and asked a question that we want to have you address. And it's connected to what Dave just shared. So Dave talked about kind of some of these initiatives we started and our partnerships in the healthcare system. Have you seen partnerships like that, or do you have partnerships like that in Austin? And whether you do or not, how do you envision that we would continue to build upon these partnerships?
Well, and that again is a great question, and thank you for the opportunity to chime in on that one. I really love the food is medicine name because that's something that we say frequently in Central Texas at our food bank. We started and partnered with the Dell Medical Center. We started a diabetes box program, and based on exactly that, we tailored meals toward those that they referred to us that were having or struggling with diabetes. It's a fairly new program, not a lot of results yet. Sometimes those types of results are hard to track as well because you provide the meal, but unless you're providing all 3 meals a day, then sometimes it's hard to keep up because I may provide you breakfast and lunch, but I have no idea what you're doing for dinner.
Exactly.
And therein lies the challenge relative to gaining appropriate outcomes. But well, we have been, and before the pandemic, we had put in the old strategic plan actually that we would get to the point where we were distributing fresh produce at a level of 50% of our total distribution.
Fantastic.
And we get a lot of produce from South Texas, down in the valley. And they distribute and they produce a significant amount of fresh produce across the country. And we also partnered with other food banks across the state as well to provide to get as much fresh produce delivered as we possibly could. Challenge is getting our partner agencies, getting our partner agencies to adopt it at the same level that we have adopted it.
Yeah.
But we're not, I'm taking notes feverishly here. I could not be more excited about this. And we did have, we were having conversations again, pre-COVID, everything flipped upside down, where we were working with another healthcare organization to even potentially put a pantry within, and on the property where basically if you go to the doctor and there was an issue that had to do with nutrition, that doctor or healthcare professional could literally write you a prescription. You take that prescription to the building next door and we would provide you with around 50 pounds of groceries, healthy food.
We actually have pantry established in one of our major healthcare partners, on the call.
Yeah.
And we have pantries established in some county health departments. So
You're ahead of us. You're bigger on it.
It's like,
We were coming.
meet people where they are.
Yep,
right?
exactly. Meet people where we are. I love I love the issue or the program, around the prenatal work. And I think that is extraordinary given the numbers that we typically see.
Yeah.
So that's kind of what basically what we were doing in Austin. And my hope is that it continues. I'm pretty sure it will because it's funded. So, but that's what we're doing here. But I think it's going to be really exciting to be able to, pick up. And one of the things that we do, and I have always been an advocate from a food banking perspective, is the sharing of best practices. I will learn from here. And I'm just telling you straight up, I will learn from here. And whoever my successor turns out to be in Central Texas, I'm sure he or she will be having conversations and I get a chance to say, look what I just learned. You can do this with either Del Med or Seton or St. David's. You should take a look at some of these. So I think that's one of the benefits of that the network itself provides, is that it provides us the opportunity also to learn from each other.
Yeah, Derek's referring to the Feeding America National Network, 200 members across the country. And, our work would not have been possible or successful without sharing it with other members across the country. And Feeding America and their national office has done and funded phenomenal research on this whole area and continues to do that. And we were able to learn from that to share it with our partners. Thanks, Derek.
Thank you.
Derek, the questions keep flying in for you, so I'm gonna keep putting you on the hot seat here right now. So Sky had a great question, and it's something I think we've talked about a little bit today, is that addressing hunger is complicated, and it's really gonna take the community coming together with different perspectives and different resources in order to solve it. So what's your approach to partnership, and how do you envision working with partners to support our mission here at Second Harvest?
So, and thank you for asking that. I love that question, and I'll try and keep it brief because I could talk for the remainder of the time period on that. First, a bit of a philosophical approach to how I think of this and how I would like to see and how we were trying to shift from providing or working with our communities to provide foods to or for or working for our communities and shifting to working with our communities. We can't do this, and we need to stop trying to do this without a significant amount of tangible feedback around what the actual needs of the community really are. And Dave know this, and certainly food bankers, for years, the measure of success for a food bank was pounds out the door. And now we are all pretty much across the country. I know you're doing it here. We had started in Austin to shift that narrative a little bit in terms of success from pounds to people or neighbors, as we're speaking of it speaking of it now. So my approach is going to be understanding and asking the question, what are your needs and what is it that we can do to best accommodate those needs? Now, I'm not going to sit here and say that we're going to be able to do every single thing, because that, just like DEI, is a journey and it's an exercise and it's going to take time. But that's where my passion lies. My passion lies with, having conversations with community leaders to gain a better understanding of what the actual needs are and having them be part of the conversation. So, when I look at the new strategic plan or the strategic plan, the engaged portion is the portion that I am most excited about, because to me, that means engaging you in the conversation in terms of how we meet the needs of the community. I hope I'm answering the question, but that's philosophically, and what programs do we put in place to extract that information? Because I'm still learning the communities here, but the communities in Austin, particularly those that have challenging needs when it comes to food insecurity, they say, you don't ask me what my needs are, you just drop a box of food. And, not only is that not necessarily optimal, it's also challenges their own dignity, because no one really wants to be asking for food in the first place. So asking the question and getting our communities engaged in the dialogue is also a way of helping them maintain their self-respect.
Yeah, and what that leads to, that whole approach, or philosophy, or whatever you want to call it, and that whole dignity approach, and it's where the food bank is going in our strategic plan, that we need to go further upstream. We're not going to food bank our way out of the food insecurity problem. We're making a huge impact day to day, and you need to continue to do that. But we need to look further upstream, because hunger is just a symptom of further upstream issues, root causes. Just a few of them that are directly related are the lack of affordable housing that we have in Central Florida is a crisis. There's a lack of over 75,000 affordable rental units in the Central Florida area. That's a 6-county area. Education is a huge piece of that. How can you learn if you don't have proper nutrition? Jobs and income, and we've gone further upstream here, and we're going to continue to do the culinary job training in job placement program, the distribution center training program in job placement. And then health, we've talked about health, and then there's transportation. So, that's part of the future direction and the roadmap that, is in place for Eric to look at, to assess and to, in time, start to tweak it, refine it, based on all that community feedback that you talk about.
That's great. So Derek, I know we love Dave and we want to keep hearing him talk, but everybody wants to hear from you this morning. So I've got another one for you. Derek, this one's from a really good friend. Marcy over at West 2 News is just an incredible partner and friend of the food bank. And we do so
Hi,
much in
Marcy.
partnership with them. So I know you'll get to meet her sometime in the new year. But Marcy said, first off, a big pat on the back, Dave, is, the programming that Second Harvest has developed over the last 10 years is just impressive and pretty remarkable. And Derek, she wants to know, do you envision growing more unique programming or focusing on growing existing programming, or maybe doing a combination of both simultaneously?
Well, and that's a good question. It basically is going to depend. I mentioned early on about adaptability. Part of that adaptability is understanding what the needs of the community might be. That might require a shift. There's a strategic plan in place that accommodates both of those. And my objective at first is to execute on that strategic plan. It's an ideal scenario. It happens to be a strategic plan that I like. Trust me, I've inherited them and oh God, are you kidding me? I think it's very thoughtful, the pillars, feed, empower, engage, nourish. I think those are strong and they play to pretty much all the dialogue that we've had today. So my point would be foundationally, it's in place to move on that. Will there be some shifts? Probably so, because our environment is going to change. Feedback that we will get from our community will require us to make some adjustments. But I don't think but I will continue to build and continue to grow as much as we possibly can. However, I want to go back, Dave, when you mentioned, about the root causes. I mean, we all know that the root causes of hunger is poverty. And we are not going to food bank our way. But that's when workforce development programs come in. We have a culinary program at Central Texas, and we partner with Whole Foods. Whole Foods is headquartered out of Austin, in case y'all didn't know that. And they also happen to be the largest in terms of volume of meals that they distribute in their store restaurants. They're the largest ones in the city.
Wow.
And there are only 4 or 5 locations, but in terms of raw numbers. And our top 2 culinary students get an opportunity to interview directly with Whole Foods straight out of our classes. Now, I'll tell you why that's important when we speak in terms of workforce and independence and poverty. So many of our students, and we don't charge for this program, by the way, so many of our students are second chance. This is a second chance opportunity. Our very first graduate 3 years ago had been homeless. And so imagine being able to go from potentially being, excuse me, that's not the right term. It is experiencing homelessness. Imagine going from that to $20 an hour in benefits. Yeah, I get goosebumps thinking about that. There is nothing more life-changing than that. That's one of the reasons I'm excited about being here. So we will continue to focus on not only the feeding piece, but also on the empowerment piece as well, because we want to end the cycle, particularly around chronic food insecurity. And the only way to end that cycle is to provide pathways for them to to lift them out of that. Part of its workforce, part of its housing, part of its legislative. There are so many elements to that, but that's my thought process. And I'm lucky enough to already have the foundation laid with the plan that you guys have already developed.
Great.
Wonderful. So we only have a few minutes left here, but we have a question that's kind of at the core of who we are and what we do. And so I invite you both to kind of jump in and address this as you see fit. Can you just explain a little bit more about how food banking works, how we work with the community to feed our community, to feed our neighbors who are facing hunger?
Boy, with just a few minutes left, that's a tough one.
It is. So I will let you do it since this is, and because I don't think I'll be saying anything very much different, but go ahead.
Well, I'm going to give a real short headline answer, and I know it's more important that you hear from Derek. You know, I'm not avoiding the question. I know the answer, and I don't want to go on and on about it. You know, but how we provide this food to the community, you know, it's just a variety of ways. The food bank is a phenomenal platform to work from. You know, and we serve the 6-county area. We have 550 partner feeding programs that vary dramatically from hundreds of small emergency food pantries to large shelters and everything in between. So, you know, we're that central access point of bringing in all these surplus resources. And then, you know, those partners accessing it from each of our 3 facilities that we have. Now, beyond that, you know, we've really started changing. You know, 10 years ago, that was probably 100% of our business model. And now that has changed dramatically, that is probably 40% of our business model. So what's that other 60%, you may ask, you know? And that's a number of programs that we created that, and a lot of it's around mobile and being mobility to taking the food to the people, because we mentioned transportation as a major issue. You know, 40% of the people who are served by our 550 agencies do not have access to working personal transportation. And I don't know how many of you have taken a bus in Central Florida, but, you know, we were talking to one grad out of culinary, and she takes three buses to get to work. And the bus schedule when she gets out of work is late at night and they're not running. So she has to sleep at the bus stop, right? And wait for that 2.5-hour ride back. Got off on a track there, but we're providing food in a bunch of ways. You know, during COVID, the mother of invention, right? And just incredible innovation. And we've developed a home delivery program. Home delivery of food. I never thought in all my years of food bank we would ever go there, you know, but that program, we're delivering on average 1,200 home deliveries a week. And since COVID started, well over 1 million meals. Now that's an innovation that's going to live on. So that's a program. That's talk about mobility. That is the ideal, right? And then mobile pantries and mobile food drops, very significant. That was huge, especially during COVID, to getting that food out. Prior to COVID, we were doing some of that. But when we deliver it to our partner feeding programs, think about it, they may not have the storage capacity to hold on to a bunch of food or refrigeration. So for them, it's just-in-time inventory. You know, so that's huge. And we do SNAP outreach as well. You know, these are benefits that are underutilized, and it's just an access issue. So we developed an outreach of benefit specialists that are out in the community helping people sign up. And since we started that program 12 years ago, we have enabled over $120 million in SNAP benefits that were not being recouped. And I know I have donors on this call that provided initial seed money for that. The dream lives on. It's the gift that keeps on giving. So a bunch of mobile ways. And I said that was going to be short. Derek, I better stop.
No, there's no need to, there's no need to stop. And exactly the same. I mean, there is the distribution component of food banking and there's the programmatic component of food banking. And you are correct. When I first, I'll just do this with a personal story. When I first started interviewing for the Central Texas role, we chatted about this yesterday. I did not realize the level of complexity behind this business model. In fact, I was a little cocky about it. I mean, I'm coming from the American Red Cross, covered a third of the country, multiple locations, piece of cake. No, it was not a piece of cake. But aside from this, the raw distribution component and leveraging our partner agencies within their individual communities, because those are the faces, it's really not us. I love the programmatic piece, something that we were just completing over the last few weeks was, setting up a scholarship program for hungry students. We found that we had close to 30,000 students within our 21 county region that were potentially food insecure. Now we're talking about schools you've heard of, University of Texas, Baylor. Those are all part of our region. And when we talk about the self-respect and self-esteem component of that, but that's what food bankers do. They sit down and they work through, how is it I can create a program where I can ensure that this student can stay in school or at least doesn't necessarily have to worry about money or food while they're in school, and allow them to maintain their self-respect so their peer students don't necessarily view them in a non-positive light.
Wow.
These years are just as formative from an adulthood perspective as they are when they're first growing up.
Yeah.
And just that's a little insight to what food banks do. And we identify areas that we hadn't known existed before, and we come up with programs because food insecurity is, and it's pretty extensive, and we're just trying to fill as many of those gaps as we possibly can.
Food scholarship program. Marcy, if you're still on, that's one of those new and innovative things coming to a town near you. So.
Well, gentlemen, I know I asked you a very loaded question at the end of our session today, so I appreciate everybody bearing with us as we run just a few minutes long. But I just want to say thank you for both of you for your time today and for sharing who you are. I think, Derek, one of the things that I've loved about hearing you talk for the last few days is you're a personable guy. You're very open and transparent with the community. And as you've said multiple times, you want the community to be a part of what we do here at the food bank, and you want to be a part of the community. And so for those who are on here with us today, I know you'll have the opportunity to meet Derek in the new year, to welcome him in and to help him get settled here in Central Florida. And we certainly appreciate that. So gentlemen, I'm going to wrap things up here today. If you have any closing thoughts, just 30 seconds or so, please feel free to jump in.
Yeah, for those of you on the call, I can't thank you enough for the past 17 years. I've thoroughly enjoyed working with all of you together. We've created such an impact. We can't do it on our own. You've trusted us, with your resources. You've shared your wisdom and knowledge with us as well, and can't thank you enough for that. And I happily go into retirement with so many fond memories, that I can draw from over the years. So thank you from the bottom of my heart.
So I have two. One, Dave, thank you for all that you have done in their contributions to not only Central Florida, but to the Feeding America Network as a whole. You have made this food bank one of the most respected food banks in the country. And I am honored, and your feet are bigger than mine. So those are so
Size 14.
It's going to be challenging to fill those shoes. But maybe I'll just put both my feet in one at a time, and we'll do it that way. But thank you. And for those of you on the call, not only do I look forward to meeting each and every one of you, I just want to leave you with a heartfelt thank you. a lot of people, and we see it all the time. There are plenty who are very good at citing the problem, but very few actually take the time to learn about it and actually do something about it. So I want to thank you for, and by virtue of the fact that you're on this call, not only do you care about it, you're interested in seeing that something's done about it. So I want to thank you for that. And I look forward to meeting each and every one of you.
Wonderful. Thank you so much, everybody. We'll let you get back to your day and we hope to see you again in the community sometime real soon. Happy holidays, everybody.